Toxoplasma gondii is a widespread apicomplexan parasite that able to infect any warm-blooded animal species, including humans. T. gondii is a major foodborne zoonotic pathogen that can cause toxoplasmosis. Toxoplasmosis is usually asymptomatic in immunocompetent hosts. However, this zoonosis is worrisome because it can cause serious neurological, ophthalmic, and respiratory illnesses in immunocompromised people. In human, horizontal transmission of T. gondii mainly occurs through the consumption of spore-related oocysts that contaminate soil, water, vegetables, fruits and bivalves, or tissue cysts contained in raw or undercooked meats. Primary infections in humans and small ruminants during gestation may also lead to vertical transmission by tachyzoids that reach the fetus through the placenta, causing severe harm such as congenital malformation, ocular disease, hydrocephaly, abortion, reabsorption, and neonatal death. Small domestic ruminants are highly susceptible to T. gondii infections, since eating raw or undercooked lamb or sheep meat has been found to be a primary food source of infection and a risk factor for acute toxoplasmosis in humans. T. gondii infections in small ruminants are a public health concern.
Next, for the method. 1. Coating the microtiter plates with a layer of listecozoids of Toxoplasma gondii. 2. Washing the plates with PBS 20 and blocking with powdered skim mix PBSD for 2 hours. 3. Adding diluted sera control and sample to the wells and incubating at 37 degrees Celsius. 4. Washing the plates again and adding diluted secondary antibody conjugated with peroxidase, incubating the plates at 37 degrees Celsius for 1 hour. 5. Washing the plates again and adding ABPTS for the detection of bound antibodies. 6. Stopping the reaction with oxalic acid when the OD of positive sera control reach the specific range. 7. Normalizing the data using the relative index percentage RIPC formula. 8. Using the same positive and negative control as used in 2G Salivate's WP.
All the Elysha tests showed high sensitivity and specificity values when sera from the experimentally infected sheep were analyzed. The SP and SP values equal to or higher than 94% and area under curve is equal to 1. Figure 3a shows that no doubtful results were observed by the majority test. The TG salivate Western blot showed 100% SE and 94% SP. For the infected sheep, ID screen and TG salivate Elysha 2.0 followed by prior check had the best diagnostic performance out of the 5 tests. Thus, after cut-off readjustments for improving the diagnostic accuracy, sensitivity, specificity, and kappa values reached almost perfect values as shown in figure 3a in table 3.
Next, the other side graph showed an Elysha test which analyzing sera from sheep neutrally infected. The differences this graph with previous graph is the sensitivity and specificity values is equal or higher than 95%. The value of area under curve need to be equal with 1, and this graph resulted a doubtful base except a prior check. The best diagnostic performance is big type, then followed by ID screen and TG salivate Elysha 2.0. Big type is the best diagnostic performance because the sensitivity is 100%, the specificity is mostly accurate, which is 99%, and the area under curve equal to 1. Compared with ID screen, the sensitivity is also 100%, but the specificity for ID screen is a bit low, which is 97% only. Meanwhile, the sensitivity and specificity for TG salivate 2.0 are the lowest between 3 diagnostic performance with 96% and 100% rapidly. However, all tests can be improved by cut off their values based on the TG-ROC analysis. For extra information, we also can analyze the best performance based on their kappa values, or known as K values. If the value is more closer to 1, means the test representing the best performance.
Without further ado, let's move on to the discussion. All Elysha tests perform well in identifying infections whether they were from experiment or natural occurrence. Adjustment in the reading further improve the accuracy of the test. However, when testing for a parasite called Encaninum, some Elysha tests give a lot of incorrect positive results. To fix this, they suggested changing the cut-off values based on the situation in the epidemiological scenario. In some tests, there was a problem where the immune response against Encaninum looked similar to the response against another parasite, T. gondii. This cross-reactivity led to false positive. This issue had been seen in other tests before, like ID strain, and a test using a combination of two proteins, which is SAG1 and GRA8. A specific Elysha test called TG salivate 2.0 performed well in initially identifying infections in both sheep and goats. This was expected because similar tests using freeze-dried parasite called Leophilus were known to be very sensitive and accurate in the past.
All tests, regardless of the serum panel tested, should good to excellent diagnostic performance and agreement. However, when PrioCheck analyzed serum samples from sheep naturally infected with T. gondii, it showed a slight decreases in SP and K values relative to the other tests. When it came to the outcomes using sera from naturally infected sheep, ID screen performed better than PrioCheck, which revealed lower SP in comparison to previous studies. The cross-reactivity between anti and caninum antibodies and a large number of T. gondii antigens as detected by TG Salivet WP with all ELYSA tests that at any given cut-off value displayed a higher percentage of false positive findings, which is around 15 to 65%. Since T. gondii and caninum are both aptly complexant parasites that share an autologous protein cluster, it is strongly suggested to investigate cross-reactions between anti and caninum antibodies and T. gondii antigens in order to achieve reliable results. But as antibodies against the parasites were not examined before the infection in the sera panel use, cross-reactivity with other closely related parasites like Haemondia species and Sarcoidosis species cannot be completely ruled out.
All the serological tests compared are accurate enough for serological diagnosis of T. gondii infection in small ruminant. However, they adjust the cut-off values are recommended to increase diagnostic performance. Moreover, cross-reactions between anti and caninum antibodies and T. gondii antigens can harm the analytical specificity more than initially thought and should be considered when defining a criterion of seropositivity by WB and when using such serological tests for diagnostic purposes. Practical recommendation for diagnostic laboratories to discard false positive reactors could be the use of both readjusted cut-off values estimated with sera from naturally infected sheep and those samples with results in between, which is doubtful results, should be further analyzed by a specific and confirmatory WB test. The employment of well-characterized sera, including false positive reactors, should be an essential requirement for future developments or validation studies carried out in small ruminants.